Of millions looking to buy health care on the federal exchange. You need to hurry up. You got about 10 hours left to get it done.
Yeah, that enrollment deadline is coming up fast for Obamacare. It ends at midnight on the Pacific Coast and 3 a.m. right here on the East Coast. 7 News reporter Dave Jordan has been reporting on enrollment now for several weeks, right, Dave? And he's joining us live with the very latest information on this, Dave.
Yeah. About a short in time period, Amy. Last year, they had 90 days to purchase health care coverage on the federal exchange. This year, they only have 45, so the race is on to get all of this done before the deadline.
$516 on the high end.
This is how Greer insurance broker Guy Fury spent the last 6.5 weeks working to help his estimated 2,000 clients get health care coverage. Time is of the essence.
It's a challenge when you have such a limited time frame.
This year, he only had 48 days to work with, at least on paper anyway.
Of those 45 days, 14 of those days are holidays or weekend days. So there was only 31 days in the business days to sign up for coverage.
Millions of people across the country who didn't have health care coverage are dealing with the same tight deadline, forced to purchase coverage for the first time.
We're seeing a lot of people that have left a job where they've never even had to worry about individual insurance, and all of a sudden they're overwhelmed. They don't know how to do it.
As of last Saturday, 4.7 million people purchased health care coverage through healthcare.gov, according to federal numbers. That's an increase of about 650,000 people from this time last year.
More people are signing up in the early days than did last year. It's kind of hard to tell how much of that is because people are aware of the earlier deadline, and alternatively, because people are more interested in doing it.
Neil Caesar, president of the Health Law Center, says early numbers suggest more lower-income people are signing up and at a faster pace, which could mean lower premiums for them.
Certainly with the subsidies in place, the premiums are going to be low, and in some cases even lower than they were last year for people who are getting subsidies.
It's that expensive.
As for Fury, he plans on working through the end of this enrollment period.
We have on average met with more than 20 a day. So we've done the very best we can to help as many people as we can.
And we checked on enrollment numbers here in South Carolina and North Carolina. They have not been released yet. That will likely happen sometime next week. Back to you, Amy.
All right, well, Dave, the deadline is clearly here. Are there any extensions available?
There are extensions if you live in a hurricane area that was affected last year. Some parts of South Carolina will be eligible. Florida and Georgia definitely will. And there will also be extensions for people who live in states that have their own extensions, or their own state exchanges, I should say. The deadline stretched a little more. By the way, we should tell people if they decide that they don't want to sign up for health care coverage on any exchange, as per state law, they will be slapped with a $700 fine or 2.5% of their income, whichever is greater. Amy?
All right, Dave Jordan, important to know that. Thank you.